We have just had our break. Did everybody notice the break go by very quickly? So in order to keep us reasonably on time, I'm making the decision that we should proceed. And so the next presentation is by Dr. Keith Yeates, and this is in keeping with the broad number of topics that we wanted to cover this evening, one of them being concussion in children. And Dr. Yeates is a renowned expert in this. He's currently a professor in the Department of Psychology, and in fact, he's head of the Department of Psychology at the University of Calgary. He's also an adjunct professor of pediatrics there. And most importantly, he is the inaugural chair of the Canadian Concussion Network, which many of us are hoping is going to continue to be a great way for communication among all of us who are in the concussion field. So thank you for leading that important function in our country. He's also an expert on pediatric brain injury. And so without encroaching further on his time, Dr. Keith Yeates, please tell us about concussion from your perspective.
Of course, I did the classic Zoom. I started speaking before I was off mute. Thanks, Charles. I really appreciate the introduction as well as the invitation from you and Dr. Green to come and be part of your symposium this year. So I was really looking forward to this. I'm going to try to put my slides on, and you can tell me whether you can see them or not. I'm assuming that you can. And I do want to mention that we're part of a large integrated concussion research program here at the University of Calgary. So I have a lot of colleagues here doing research on concussion in kids. The thing that struck me in 30 years worth of practice in this area is
Dr. Yeates, we actually don't see your slides yet.
That's interesting because I've got them right up on my screen.
Do you mind just taking a look for the green share screen button? And
yes, that would help, wouldn't it? Okay.
They're coming.
Okay, we do see them now. Thank you.
Okay, I'll start over. So as I was saying, after 30 years of working in this area as a clinician and researcher, I never fail to be amazed at the different ways that kids can get injured. And of course, many kids sustain concussions in sport and recreation, but they also find some very worrisome ways for parents and others to get themselves injured. I thought tonight I'd talk about three topics fairly quickly. How often does concussion happen in kids? What are some of the common outcomes, and what can we do about it? So in the United States every year, about 500,000 kids, 14 and under, go to the hospital for a traumatic brain injury. And most of those involve concussion or mild traumatic brain injury, but that's probably just a little bit of the tip of the iceberg. The estimates are that it's more likely in the millions. In fact, it's been estimated that 1 to 2 million sport-related concussions happen annually in the United States. And while it's a little bit harder to come by good data in Canada, based on epidemiologic studies as well as by translation from what's happened in the States, probably a pretty good estimate that about 180,000 concussions a year happen in Canada in kids under the age of 18. But one of the problems of trying to come up with a good number is that the number is actually changing with time. So some work that we've done in Alberta, this is my one of my graduate students, Crystal Witterbrongle, did her master's thesis on the incidence of concussion in kids in Alberta. And what you can see here, and particularly in the blue line, is that the incidence of concussion, that's the rate of concussion every year, has doubled since 2010, from about 600 per 100,000 kids to over 1,200. And that is very consistent with national numbers. And it's probably not that concussions are actually more common. It's that with raised awareness and parents being more concerned and coaches being more concerned and even the kids themselves, we're getting better reporting. But this is probably still underreporting because these are children who come to immediate medical attention, either in the emergency department or in their physician's office. And we know that a lot of concussion goes unreported or undiagnosed. So what happens after concussion? Traditionally, we've paid the most attention to symptoms, things like headache and dizziness, and mental fog. We've also paid a lot of attention to people's balance because it's a pretty common problem to have balance difficulties after concussion. We also use cognitive testing where we test people's attention and reaction time. In more recent years, we paid a lot of attention to some newer outcomes like vestibular and ocular motor function because of we know that concussion can affect visual function, can affect the vestibular system so that you see dizziness as a common complaint. We've been paying a lot of attention to cardiovascular and cerebrovascular outcomes, in part because we've begun to recognize what an important role exercise actually can play in recovery. And I'll talk about that in a bit. We're also starting to pay a lot more attention to neuroimaging, particularly major advances in magnetic resonance imaging in a way of looking at very subtle changes in the brain, not the kind of thing where you can look at an image and see a lesion or an abnormality, but subtle changes in the nature of the brain that can be revealed by neuroimaging. And even more recently, a lot of attention to fluid biomarkers, trying to find a way of being able to measure the presence of concussion without relying simply on symptoms. But having said that, symptoms are what people complain about, and it's what interferes with people's lives. And the question has been, how common is it for kids to have persistent symptoms? We typically define symptoms as being persistent if they last at least 4 weeks. One of my other students, Leah Chadwick, and several of us did what's called a systematic review and meta-analysis. And basically what that means is we scoured the literature for any study that told us what the percentage of kids are that have persistent symptoms. And then we can sort of pool that data, across all those studies. And in essence, we came up with an estimate of around 35% of kids have persistent symptoms lasting at least a month. Now, interestingly, the rates were higher for older kids, mainly for adolescents as compared to younger children, also higher for girls than for boys, tended to be higher for children who were seen in clinics as opposed to kids who were seen right at the time of their injury. That's probably because kids who come to clinic in part because they continue to have persistent symptoms. So it's likely that that 35% estimate is just a little bit high. And it's probably, if we look at kids, all kids who get concussion, it may be a bit lower than that. But that's clearly a minority. So the good news is the majority of children are recovering by 4 weeks. The bad news is there's a substantial number of them that aren't. Now, there's a lot of variability in the nature of the symptoms that kids present with after their concussion, and a lot of variability in the severity of those symptoms. We recently did some work, and this is consistent with other research that's been going on, showing that there's a cluster of symptoms that seem to be sort of vestibular in nature. So balance problems, dizziness, visual disturbance, nausea, sort of all lumped together and commonly go together in the same patient. Other symptoms are more migraine headache-like. Sensitivity to light and noise and headache tend to cluster together. Mood problems tend to cluster together. So sadness, nervousness, and irritability. And cognitive symptoms like difficulty concentrating and difficulty remembering tend to go together. Fatigue tends to sit by itself, and it's a major symptom. In fact, it's the symptom that's reported most commonly in association with all other symptoms, with headache and dizziness being among the two more common physical symptoms. This is a reflection of the heterogeneity or the variability in concussion. And that's one of the challenges in working with kids with concussion, is that there's not one single presentation. There's lots of variability in the kinds of symptoms they have and how they go together and how severe they are. So what can be done about concussion? I'm going to talk briefly about prevention and treatment. So concussions can be prevented. As some of my friends that really do a lot of work in prevention like to say, there's no such thing as an accident. Almost all injuries are, in essence, preventable. And I know that Pam Facelli is going to be speaking after me about the efforts to prevent concussion. Concussions can be prevented, particularly in the sport and recreational context. There's growing evidence that sport policy, rules, equipment, and training can make a big difference in the incidence of concussion, whether it's mouth guards, helmets, getting better helmet fit, enforcing rules and the like. There's growing evidence that we can do a lot to prevent concussion. Probably the best evidence in Canada comes to the work done on body checking. And The work showing that body checking was associated with a significantly increase to concussion led to a national change in the rules on body checking, and it's led to probably a reduction of about 5,000 concussions in kids in Canada annually. This is work done by Carolyn Emery, my colleague here at the University of Calgary, and others here. Led to a really important change and has really made a difference. And I will note, for those of you that are big hockey fans like I am, what's interesting is they were able to eliminate body checking. It did not change the skill level of the kids. It didn't disrupt their development of skills. If anything, there's some evidence to suggest that they actually developed their skills better in the absence of body checking. So concussions be treated, because even with the best prevention, we're still going to have kids who get concussion. Until the last 10 years or so, there really was very few randomized clinical trials. And clinical trials are the sort of gold standard evidence for the effectiveness of treatment. Most recommendations for treating concussion were based on expert opinion. And unfortunately, experts are sometimes wrong unless they have evidence to back up what they say. Well, fortunately, there are a growing number of recent clinical trials that are beginning to give us more of an evidence base for the treatment of concussion. For example, there's a number of trials now that suggest that early sub-threshold, so-called sub-threshold exercise, where we do exercise, but not to the point that a patient becomes significantly symptomatic, and after a brief period of rest can really promote recovery. We've shown that use of melatonin and cognitive behavioral therapy for insomnia can significantly reduce the sleep problems that many kids complain of after concussion. And improving sleep often results in improvement in a variety of other symptoms, because we know that a poor night's sleep can make us feel bad in a variety of ways. Catherine Schneider, who's pictured here, has shown that cervical vestibular rehabilitation can make a really big difference for kids and adults who complain of dizziness, neck pain, and headache after concussion. And then we've also been able to show another study that showed that multifaceted collaborative care that combines pharmacotherapy, psychiatric care, and psychotherapy can make a big difference for kids who have concussion and then have significant emotional difficulties afterward. For more information, I really highly recommend that you take a look at the Living Guideline for Pediatric Concussion. It's an online site and involves makes available some really good resources for families and coaches and others. This is a guideline that was originally started with support from the Ontario Neurotrauma Foundation and now is a living guideline, which means that it's continually updated. Another really good source is the Concussion Awareness Training Tool, or the C.E.T.S, developed by folks at the University of British Columbia. There are C.E.T modules for coaches, for parents. There's going to be one for youth soon. Really good way to learn about concussion. And here at the University of Calgary, we've been periodically offering a massive online open course for folks who really want to dig in and learn more about concussion. I want to thank Charles for mentioning the Canadian Concussion Network. This is a national network that we've established with support from the Canadian Institute of Health Research. We really hope to establish a national research agenda and a national knowledge translation agenda that can really make a difference for concussion. And in this case, not just kids and not just sport related, but all concussions, including the unfortunate concussions that arise from intimate partner violence that were already spoken about. We have a number of other populations that we know are at risk that haven't received enough attention in the concussion research world that we hope to promote. And our real goal is to solve the various dimensions of the concussion challenge, not only in Canada, but the world. Canada really punches above its weight internationally in concussion research and knowledge translation, and we hope to continue to take advantage of that. Well, I'll just mention that one of the things that we're doing in the network is helping support something called a priority setting partnership. This is a very structured way of bringing together patients, caregivers, and clinicians to identify the major unanswered questions, in this case, in concussion. We hope to present the initial findings of this partnership in just the coming months. And it will really help us formulate our national research agenda in terms of what are the questions that are important to the public that aren't answered and that research could play a major difference in making a difference about. So I want to thank all my collaborators and the various agencies and funders who support my work and the work of my colleagues. I want to thank all my trainees and staff who make the work that I do possible. This is very much a team effort, and I would welcome any questions you have. Thank you.
Well, that's great, Keith. We really appreciate that terrific talk. And we have some questions. Can post-concussion syndrome be permanent? And when it is permanent, how do you determine that? What are the criteria for saying that it's permanent?
Yeah, I think we've moved away, as you know, Charles, from using the term post-concussive syndrome, in part because there is no single syndrome. That's part of the challenge with concussion, is that we have many different, in a sense, syndromes or symptom presentations that happen after concussion. I would say that it's actually fairly rare for concussion to result in permanent disability. That's the good news. As I said, most kids anyways, the majority do tend to recover well, often in the first month or so after their injury. But there certainly are a smaller minority of kids who go on to have more persistent problems. The truth is, I don't think we know exactly how many might have really permanent problems, partly because we don't have enough research that follows kids for years after their injury. We really need more of that. I certainly have seen kids where there's a sense that they continue to struggle with difficulties for multiple years after their injury. And again, fortunately, that's a minority. I don't know when you call something permanent. I tend to be an optimist and think we can always promote change. And even when we see patients who are 2 to 3 years out of their injury, I'm always curious what hasn't been done for them. What could we do differently that might promote recovery? So I don't know that there is a clear guideline as to what you call permanent versus not. I think we are all know, though, that in brain injury in general, we see the most change in the first 1 to 2 years after an injury. After that period of time, you don't tend to see as much recovery. So I suppose maybe in that sort of time frame might be relevant.
Well, thank you for trying to give us your answer to that difficult question. And last question, which is also difficult. If it's 35% failure to recover by 4 weeks, do you think that it resolves after that in a rate similar to that of adults, which Randy, who was asked this question, feels is about 15%?
Yeah, that's a really good question, and it's a good point. I think the data does suggest that there's continued recovery after that 4-week period in kids. In fact, the last International Sport Consensus Conference, noted that recovery in children and adolescents seemed to be a little bit delayed on average compared to adults. So I do think that as we follow kids out to 6 months and a year, we do see a continued recovery in a certain amount. And I do think that there's a fair amount of data that would suggest that we get down to that sort of 10 to 15% with persistent problems that are lasting 6 months or longer, more like the same sort of percentage we often hear reported in adults.
Well, thank you very much, Keith. Those are difficult questions, and thank you very much for sharing your insights and efforts with all of us.
Well, thank you for the invitation, and I look forward to the symposium tomorrow.